Welcome everyone to today's webinar, Building, Accelerating, and Retaining Staff and Production. My name is Kayvan Mott, co-founder of the Doc Sites. We do two things for dental practices, websites and marketing. I'm really excited to be joined by Darius Somekhian today. Darius, how are you?
Doing fantastic. Thanks for having me today.
He's so excited. So Darius is with Cloud Dentistry, the premier platform to find talent for your practice. We're really excited to share with you what we have in store today. Really excited to talk about this, Darius, because I don't know about you, but one of the biggest problems I keep hearing from practices is staffing issues and getting the team to work together and having a team, a cohesive team. So very excited. What have you been seeing as we wait another minute or so before we get started?
Well, we've seen obviously that old adage of the shift post-COVID that went about,
Yeah.
where about 80% of the workforce, mainly around the hygienists and the DAs that are under 45 years of age, for the most part, they decide to start temping or going part-time because obviously they value lifestyle more. And then above that age group, there was a big sort of wipeout of what was available in the labor economy because about 30-40% just retired overnight. So that constraint of supply started to create this sort of situation where
That we're
offices
seeing.
are starting to now cross-train their staff members to be able to fill in the void.
Yeah, and it's exactly what we're seeing. So we're really excited to share this with you. I'm going to share my screen and we'll get started. Let's go here. Okay, so welcome everyone officially to our webinar, Building and Accelerating as well as Retaining Staff and Production. My name is Kayvan Mott. I'm a co-founder of the Doc Sites. We do websites and marketing for dental practices. I'm also joined by a special guest, Darius Somekhian at Cloud Dentistry. They are the premier platform for finding talent for your dental practice. So tonight's webinar will go like this. I will be presenting myself, and then Darius will also be presenting afterwards. So I'll speak for about 25 minutes, and then Darius will, and people are going to have questions. We know you're going to have questions. So we've left a special part of the 1 hour webinar today for questions for Q&A at the end. So before we get started, I just want to, in the Zoom, let me see if I can put a little link there. Just so if anyone wants to book a time or a call with me, that is my calendar link, so you can do that, and we'll get started. So before I present, I just wanted to share you a personal story of Dr. Wasim. Many years ago, several years ago actually, Dr. Wasim acquired a practice, and this practice was in disarray. Spent all this money to get into dentistry, and he had an unengaged staff and dwindling production. Like, he was really in a bad place of what he's going to do now that he's owned this situation. So he ended up turning it around, and first thing that he did was realize, hey, I have to actually be the one taking ownership. So he did. So he showed up early, set the example for the team, and he realized a few things. The team was untrained, they were not asking for reviews, and treatment acceptance was low. So he fixed all of those things. So what he did was he actually went in there and asked the team, show me how you pick up the phone. And he trained the actual team to pick up the phone better. And he coached them through positive reinforcement, and it worked, right? He changed technologies. He put in intraoral cameras where patients could actually see what was going on because they could see it. They trusted him more, and they were more likely to say yes to treatment. So his treatment acceptance started to rise. And then he did a special thing. He engaged his team, who was at first not motivated. He engaged them and motivated them to ask for reviews. And he did so by incentivizing them. I'm going to share with you the exact strategy he used later in the webinar. And by doing it, his staff started to ask for reviews. All of a sudden, the internal team started to to move around slowly, but surely they turned the ship around. They were rowing in the same direction. That's when he came to us and he hired the doc sites for websites and marketing. And through our efforts, we built him a trustworthy website. We got him more visible on Google. Emergency patients were finding him. Dental patients were finding him. And now that he had his team in order, they were actually being converted to appointments. They were actually being taken care of. They were saying yes to treatment. They were leaving reviews, and this cycle led to a success. In 3 years, he went from, what am I doing? What did I get into? To successfully selling the practice at a healthy profit and opening his next practice. Why am I sharing this story with you? You know, he wasn't anyone extraordinary. The reason I'm sharing this story with you, because your practice success takes internal team and your external team rowing in the same direction. That's what he did. And that's what your practice success is going to take. In this analogy, when I'm saying rowing in the same direction, we're talking a couple elements, 3 people rowing in the same direction. One is you, the dentist, the owner, the practice manager. 2 is your internal team. So that's your office manager, your staff, the full-time, the part-time, the temp. That's your team, internal team. And then you have your external team, which is usually a marketing company. When all those are rowing in the same direction, that's when you can get the increase in production, collections, and people flowing together. So why even do this? Like, really? Do I need to change and improve things? Couple key reasons. 1, you can increase your production and income, which might be why you're here. 2, by getting everyone together, you're going to improve your case acceptance rate. 3, when everyone's on the same page, guess what happens with the patient? Trust goes through the roof. 4, you're going to attract more quality patients and you're going to increase your online visibility. And how many of you would want more quality patients? Not just any patients, but quality patients. Whether that's the one who does implants, or maybe your bread and butter, or maybe you want to do more restorative cases. But imagine everyone rowing in the same direction and the end result is quality patients. So there's a big framework of what I go over and discuss for how you can attract those quality patients. It's really 4 phases. The first phase is giving great service. The second phase is building a trustworthy website. The third is marketing. And the fourth is what we're going to focus on today. So there's these 4 phases. The fourth is what we're talking about today on the team, specifically shared goals and greater gains. How to align your staff, your internal team, and your marketing company, your external team, for increased practice production. So today's agenda, number 1, we're going to talk about leadership. That's where it starts. Number 2, you're going to learn 3 quick and easy ways to engage your staff. It's your internal team. And then number 3, we're going to go over the 6 biggest mistakes costing you new patients and how to hire the right external team, your marketing. And stick around for a special offer as well. Quick 15 seconds about me. I'm the co-founder of DocSites. I've been working in the dental industry for 16 years. We actively serve over 800 dental practices every month. In short, everything I'm sharing with you is based on what I see works and doesn't work with dental practices. Super important message. If you happen to be taking notes, this is the slide you want to take note on. And it's this: the single biggest mistake that dentists and practice owners and managers and team make when it comes to team success is this: a set it and forget it mentality. How many of you guys remember this guy, Ron Popeil? I remember he used to sell a device, right? It was like a cooking device. You put in the food, you set it and forget it, right? You don't think about it again. You can't treat your team like that, right? You can't treat your operations and your marketing like that. You have to be proactive. Question: let's say someone comes into your practice and she's great, she's referred to you, and she wants to, get her teeth worked on. She didn't like the last dentist. Would you start working on them right away? Like literally take out the tools? No. You do a diagnosis first, right? And accurate diagnosis is the cornerstone of successful treatment. That's something I really do believe. But have you ever diagnosed where you are in your practice? You're going to learn a lot today, but has anyone ever sat with you and said, here's how you're doing? That's what we'd like to offer you, a free 15-minute Zoom. It's a web and online assessment of your dental practice. It's done by me. And again, it's personalized for your practice. So if you're interested in it, that's the number to text, take a screenshot, or use this QR code and set up a time at your convenience. So I'm sure you've been there before, right? Working on a team, everyone's kind of unengaged, we're going in different directions, and it's not a good feeling. So what can we learn from those who do it well? We take the analogy of a rowing team. There's two things that a rowing team does well that I believe we can learn in our practices. One, everyone on the team knows where they're starting and where they're finishing. Every race in rowing is 2,000 meters. Every single person on that rowing squad, the internal team, the external team, and the leader knows where the finish line is. So if you take a look at this image, this is called a coxswain in rowing. It's the leader basically telling the team, where to go and leading them. This is you as the practice owner. And really they have two responsibilities. One, they set the direction for the team. And two, they provide feedback. Interesting thing. Look very closely. What do you see? She's not rowing. They don't have to do the rowing, okay? Just remember that as the leader. So let's talk about setting a direction for your team. It's really as simple as creating a point A and a point B and communicating that to your team. Where's the starting line? Where's the finish line? That's what you need to do. You need to easily communicate that to your team. So let's take the example of new patients, because we know one of the fastest ways to get more production is new patients. So you have to understand that, hey team, right now we're averaging 7 to 10 new patients a month. That's point A. Our point B is we want to get to averaging 30 to 40 new patients a month. Once you say it as simply and clearly as that and you know it, the team goes, got it. Everyone's on the same page. So now we talked about direction. How do you give feedback? Tracking is like a truth serum. Not tracking is like hiding the evidence. So let's continue the journey of we want to get our new patient numbers up. How do we get everyone on the same page? 3 steps. Number 1 is you ask. Number 2 is you track. And number 3 is you look. So ask the patients, how did you hear about us? Don't ask them who referred you. You know why? Because if you say who referred you, they're going to say no one. That doesn't give you any information. Ask them, how did you hear about us? Secondly, track. It doesn't work if you're hoping your staff members remember. Make a mandatory field in every new patient intake form that says, how did you hear about us? That way they have to fill it out, right? This is something we do in our company. We've been a marketing company for 16 years. We still ask everyone and we complete it. So if you haven't already, make a mandatory field on your new intake form and say, how did you hear about us? Because you have to track and see, okay, is my marketing working? Or is everyone on this intake form saying insurance? That's going to give you feedback that, guys, what we're doing with our new patient numbers is not working unless you want more insurance patients. The third part is to actually look, because what you don't want to do is you're tracking something and no one looks and no one cares. So make it mandatory to look in your weekly or monthly team meetings. Again, your role as the leader, as the practice administrator, manager, dentist, owner, is these 3 things. 1, communicate to your team, here's point A and here's point B. 2, track your results. And 3, provide feedback to your team in a way that's empowering. So this is a really popular movie that came out recently on Netflix called The Boys in the Boat. It's about in the 1929s, the men's US team was not doing well in rowing. And this coach decides they're going to do the same training, the same rowing, the same everything. The only difference is they're going to go get new people who don't know much about this and train them up. And without giving the movie away, by creating those new people and bringing them into their team and having this coxswain leader lead them, they got very, very far into the Olympics. I won't ruin it for you. The reason I'm sharing this with you is this: who you hire is more important than how it's done. Who that coach brought on to the rowing boat was more important than the technical rowing. So let's talk about your internal team now that you know, right, what your role is. The office manager, the team, the internal team, the staff, the hygienists. In my experience, if you want to improve production, collections, just the practice, there's 3 roles they need to do in addition to other things. 1 is converting phone calls and follow-up systems. 2 is giving great customer service. And 3 is asking for reviews. Think about the story I shared with you earlier. Dr. Wasim trained his team how to pick up the phone. He trained them to give better service, and then he incentivized them to ask for reviews. And that's what helped turn things around. So right now, I'm going to share with you what I believe are the ABCs, the fundamentals of engaging your internal team and staff. This perfectly says it. This is Steve Wen. He's the billionaire owner of the Wynn and Encore and a legend in the hospitality business. But more than anything, he really understands people. Listen to what he has to say.
What determines guest experience? The carpet, the crystal chandeliers, the hand-woven fabrics? 10%. 80 to 90% of the guest experience is determined by the way they're treated, because only people make people happy. My business challenge is to get my employees to give of themselves in a way that my secretary takes care of me. So how do I do that? Well, what's important to the line employees? Money? No. If people think they're being paid fairly, they're there. The strongest thing in human dynamics is self-esteem. Anything that makes someone feel good about themselves will be repeated incessantly.
Powerful. Anything that makes someone feel good about themselves will be repeated.
What determines guest
right?
experience?
So this is the first A, acknowledge. Acknowledge your team. Verbally acknowledge your team. Look for ways to applaud behaviors and recognize it with your team, because we all know what the industry is. People are stressed out, they're leaving, they're juggling so many things. Now more than ever, people want to hear and see and feel appreciated. So acknowledge your team. The B in the ABC is be the example. I've realized owning a business, people don't want to hear talk. They want to see you lead by example. I don't have kids. I have 6 nephews, 7th one coming on the way. I know one thing for sure. They don't watch what you say. They watch what you do. Your team is the same way, right? So if you're going to be the one, hey, I want to, treat people fairly and ask for reviews, guess what you get to do as the leader? Be the example. And then the C is cash. I know we love self-esteem. I know that's important, but you know what's also motivating? Cash. Surprise. People are really motivated by money. So I shared with you earlier in the story, here's how Dr. Wasim got his staff to actually ask for reviews. He gave him an incentive. He said, guys, let's get together, team huddle. We all know we want to give great service and I want to reward you. So as a team, anytime we get 15 5-star reviews, I'm going to give each of you cash or a gift card. And here's the thing, it was not an individual reward. So Kayvan didn't have to do it and then I pay only Kayvan and not the other team. No, everyone on the team got paid. And I asked him, so what happened? Like, did you have to manage it? He's like, no. My front office picked up the phone a little faster, a little nicer. My back office hurried a little bit. Everyone wanted the cash incentive, so they took better care of the customers and they asked. So there's the ABCs. So we've talked about, the first 2 parts, which is yourself, the leader, right? Setting the tone by painting a clear picture. Here's where we're trying to go. Here's point A, here's point B. 2, tracking the results, looking at the results, and then 3, providing feedback. And the feedback that leads us to the internal team, which we went over. How do you engage them, accelerate them? The ABCs, acknowledge them, look for ways to acknowledge them. 2, be the example in the practice. And then 3, give them a cash incentive. So now we're going to talk about how do we align the marketing team? How do you make sure that you might have a great team and staff and office, but if your external team, that marketing team is off, you're not going to get very far. So right now, I want to share with you the magic pill, the magic secret to hiring the right company. Sorry to break it to you. There is no magic pill to hiring the external company. But like I said, we've gone over your responsibilities. We've gone over your team's responsibilities. What's your marketing company really there to do? There's 3 things that your external team, they're responsible for, in my opinion. 1, craft a trustworthy online presence. People have to trust you. 2, increase your visibility to patients in your community. And 3, ultimately, they're there to generate new patient calls and appointments. So now we're going to get to the 6 biggest mistakes costing you new patients and how to hire the right external team who does your website and marketing. So hiring mistake number 1 goes back to you as the leader. I know that's where it all starts. You don't know where you are, where you're going. If you have no idea of how many patients you have and how many new patients you want to get, for example, you're not really going to know what to tell the company or gauge if it's working or not. So avoid that. Hiring mistake number 2 is believing that there's a magic pill. When this new company comes, they're going to fix your problems. They're not going to fix your phone skill problems. They're not going to fix your customer service problems. They're not going to fix so many problems, right? So don't have the mindset it's going to be a magic pill. Hiring mistake number 3 is not asking the company before you hire them, how much experience do you actually have in the dental industry? Believe it or not, I've seen people say, I hired my, my husband's cousin. She does websites. She took a class. She has no idea how to market a company, market a dental company. You need to know that. Hiring mistake number 4 is not asking, am I stuck in a long-term contract? You don't want to be there. I'm sure, unfortunately, you've experienced it, right? Where these companies stick you in a long contract and you can't get out. So be sure to ask that. Hiring mistake number 5 is not knowing what are my monthly deliverables. You might have experienced this, right? You hire a company and they're like, we're doing SEO and marketing. And you're like, well, I don't understand what that is. By asking, what are actually my monthly deliverables? What am I paying you that you're doing in a number, a quantifiable number? You're going to answer that question so you know what you're paying for. And then hiring mistake number 6 is not looking at the company's online reviews or seeing what other practices have to say. You want to look at the recent reviews so you see something positive, not something negative. And those are the 6 hiring mistakes you do want to avoid. Look, to summarize everything I've shared, I don't know where you are in this journey. I don't know how far down the river you are, but probably at some point you felt frustrated. You're doing your best, you're there with good intentions, but either your team's not showing up, maybe some days you're not delivering. I know it could get hard. And the positive message I want to leave you with is that you don't have to do the rowing yourself. Hiring the right team is really more important than doing the rowing yourself. And just lastly, as I promised, for those who do want a special offer that you're looking for, are you looking to improve your practice website and marketing in an affordable and effective way? We, the Doc Sites, have 16 years in the dental industry, and we typically help 3 types of practices. 1, those who say, I want to redo my website, but I don't want to spend a lot of money. We offer monthly fees starting at $59 a month with no long-term contract. 2, if you have a website, we'll do all the work for you. 2, we help those people who are like, listen, Kayvan, I'm doing good, but I want to take it to the next level. This was the exact case with Dr. Bronwyn, a daughter-mother duo. They came to us. For years, they were sitting on an old website and online presence, and they decided to switch things around. So what was the result? This is a comment that Dr. Bronwyn mentioned just 2 months ago. Our new patient numbers have doubled since switching to the Doc Sites. Funny enough, We were able to have what we pay for better results. Highly recommend Kayvan and his team. And the third type of practice we help is those who say, I can't get a hold of my website or marketing company. They're looking for better service. They're looking for someone who picks up. We've been awarded favorite website company in 2023. We've been awarded Dental Product Shopper Best Product. I'm not saying this to like pat us on the back. I'm only saying this that like we really care about the service and we're really here to take care of you. We do all the work. And again, all of this is with no long-term contract. So if you think this is a good fit for you, we have 3 website options to choose from that we can build for you. $9.99, $19.99, or $29.99. For being on this webinar, you're actually going to get a special offer. If you text me at this number or schedule a Zoom demo with the link that I provided, you're going to get our lowest available pricing of the year. So if you're interested in that and you want to make a saving, go ahead and just text me at that number. That's my personal cell phone. Or use the link to schedule a demo. This is a 1-day special only offer. For those who are like, I don't want a website, but I'm interested in that online assessment. I want to see how can I apply this to my practice. We're offering you a free 15-minute Zoom assessment. Just text me at that number below. Again, that's my personal number. Or use this QR code, which I'll leave on there for another couple seconds. So go ahead and take a screenshot if you're interested. And then we will get to Darius right now. So thank you again for your time and attention. And at this point, I will turn it over to Darius.
Thank you, Kayvan. That was pretty amazing, actually. And all the years I've been in dentistry, it's the first time someone was able to make such an amazing analogy around leadership and the workforce that's under the umbrella of your practice. The rowing analogy was spot on. That was amazing.
Thank you. Appreciate it. Excited to hear what you have to share, Darius.
Yeah, I'm really excited to be here today. I'm going to post my scheduling link, my contact information, my LinkedIn in the chat before I forget. It's a pleasure to be here today. Would love to present to you some tips and strategies on how to go about hiring the right specialists, along with the right hygienists and DAs, and the whole team talent staff that it takes to run that machine of your practice. Let me go ahead and share my screen. I'm going to also just give you a little brief background around myself. I've been in dentistry since 1998. I'm one of those dinosaurs. I started out selling latex gloves from the trunk of my car.
We can't see your screen yet.
Hold on. Let me share my screen on the Zoom. Thank you for that, Kayvan.
Yes.
And so I was started out in 1998, and I was selling latex gloves from the trunk of my car.
Yeah, something's coming up. Yeah, this is it.
All right, perfect. Can you guys can all see my screen now?
Yes.
All right, perfect. Yeah, a little bit about myself. I started out in 98 selling latex gloves from the trunk of my car, like I was saying, and it's been a long journey. I sold my dental supply company to Benco Dental about 12 years ago, and I worked for them for 3 years. I was the first boot on the ground opening up the Southern California district. Made friends with thousands of clinicians. 3 of them I married off, no joke, by design. I just totally immersed myself on the business side of dentistry. After a few years, I got that entrepreneurial chip in my shoulder again. So I decided to start, I pioneered the agency for the traveling dental specialist called Pair Dental, PAIR dental.com. We would pair specialists as a matchmaker with offices for long-term 1099 in-house work. I probably ended up speaking to a few thousand GP practices, mostly privately owned, and specialists too that expressed interest in wanting to travel. And in that experience, I just grew this like massive insight, not just from the psychology of the specialist and the GP practice owner, but sort of like understanding the ways to be able to go about it. Obviously, everything that I'm telling you today is just based on what I've observed in the past decade of doing this. There was a little break in my history that about 4 years ago, I joined Cloud Dentistry as the head of strategic partnerships 4 years ago, and now we're merging Pair Dental with all of its specialists into the marketplace that Cloud Dentistry has. For background, wanted to start off by just putting a little comparison on the economics in place here. I'm not here to say that referring in or referring out is any better than one or the other. If you have any relationships with your external specialists, I recommend preserving that. I don't want to come across suggesting to bring in an in-house specialist and disconnect your ties with your external specialists. Those guys are the ones that are there to bail you out when you need it the most, and we all know that. But just boiling down to the economics of it here. On the left side of the column, if we took a use case where, let's say, 100 patients were referred out and 60 of them end up going to the specialist, 24 of them end up coming back. We all realize that not 100% of the patients that you refer out end up coming back. Reasons behind it is lack of tracking. Going back to what Kayvan was saying, it's very important. Other reasons may include such as the patient might be uncomfortable getting specialty treatment in an unfamiliar environment. There's probably a list of several out there that I can call like the main usual culprits why the patient doesn't end up coming back. On a use case scenario with 100 patients where 25 come back and you're only doing the restorative crown, let's say on implant cases you referred out, you end up with about $19,000 in production, versus referring in where you're able to have a higher conversion rate because the patient's more comfortable in the familiarity of your own practice. You're able to get more restorative cases done as a consequence of getting more surgical procedures done. And the outcome is a significant difference. Here's a secret that I'll share with you. In the 25 years I've been in dentistry, the DSOs that I noticed that were able to scale with efficiency were the ones that implemented specialty from a multidisciplinary approach. They brought in endo twice a month. They brought in OS once a month. They referred all the wisdom teeth to the OS. They brought in perio. They implemented the soft tissue program. And it works in harmony with one another, and it grows over time. There are certain practice deficits when you're referring cases out versus referring in. For example, you do increase the chances that the patient won't return back for subsequent treatment, right? So I'm sure if you guys look in the charts of how many you sent out versus possibly how many you're referring in, you'll notice a significant difference in the case acceptance rate. Second is that you have less control over the patient's insurance. I oftentimes ask offices when I'm having a discovery call with them saying, what are you looking for? What's the impetus that you're looking for a specialist? And the office manager sometimes is the person that's on the discovery call with me. And she says to me, you know, I got to be honest, we've been sending some cases to the endodontist and they max the patient's insurance out. And then by the time they come back in, it's like a surprise to the patient that they got to pay cash out of pocket for the restorative side. Because you don't have that control over, you know, a singular point of contact as one office manager explaining the insurances, it leaves chances and room for that sort of mistakes to happen. I'll call it miscommunications. And of course, there's a transfer of trust where you have to value the goodwill of the patient that you paid so much money as a CAC, a customer acquisition cost, to acquire, to bring in. Now you want to be able to leverage that trust. When you're referring out versus referring in, the patient's perception is a little bit on the lines of, well, I heard a lot of offices nowadays have a specialist coming in. Why are you sending me out? There are those sort of thinking patterns that come about. 60% of the patients that are referred out of the practice really never end up coming back for specialty care, from especially de novo offices that are new. They're too busy tracking is really what I sort of came to deduce off of it. The 40% that actually commit to the treatment end up converting, which ends up generating a boost of 60% in restorative treatment as well. Here's one tip I just wanted to throw out there. Tracking is everything. I'm a big believer that winners always keep count. So I wanted to throw this out there. There's a platform out there called Referra.io. It was invented by a dentist. His wife is a pediatric dentist in San Francisco in the Bay Area. They just launched. Now, this is a way that you can start keeping track of the referrals, whether you're a GP practice referring out, a GP practice referring in, or a specialty practice that wants to be able to track referrals coming inbound that's being referred out. Referra.io is a great way that you can transfer into becoming an e-prescription sort of modality when you're referring patients with your specialty slips. it's kind of silly when you think about it. Why is dentistry still sending out like 4-inch by 4-inch paper prescriptions when a patient has to go out to an office? Most of the time they lose that. And it's the specialist's office manager that has to look them up in the system. And you're not able to track what ends up happening, right? A good way of understanding how you want to get started with which specialties you'd like to get going with is first keeping track of which cases you've been sending out. Take an Excel spreadsheet or go make a Google Excel spreadsheet and make multiple columns, and each row make multiple months or multiple weeks off of it. And you end up tracking by each specialty procedure broken down by specialty type. So for example, OS, implants and third molars; perio, soft tissue, crown lengthenings; osseous, implants, full arch cases. The list goes on and on. You make this spreadsheet in a way you start tracking your cases. That way you have a full understanding as to understanding what is the most effective specialty that you can start with the least amount of effort. When you get started, make sure you don't miss the credentialing process. Some of these insurance programs, they take months to be able to add the specialist's specialty insurance fees. A lot of offices don't realize this, but specialists are able to demand a higher fee more than what a GP is able to demand. Reason being is because insurance companies are willing to pay a higher fee to a specialist who has board accredited or board eligible training. The credentialing process is also something very important that I mentioned to practices that are buying new practices. I know I may be stating the obvious, but it's so often that I hear a practice owner say, "Oh, I can't bill a network and I'm building a huge list of all these cases, and should I go and approach them out of network?" And it's just a good planning decision to get the credentialing process out of the way. When you meet with the specialist, it's very important that you discuss what plans he or she is willing to go in or out of network. And I'll teach you a little about that as we go on in this webinar series. One suggestion I like to make to familiarize the patient with the specialist is by printing these Meet Your Specialist flyers that you can hand out to little Johnny's mom or the patient when you're referring for a specialty. Whether you're referring in or referring out, that patient is probably wondering who that specialist is, and they're going to go look them up online. So you might as well give them something that has everything exemplified in the way that you want to present it to the patient. This way, you familiarize the patient with the specialist more, and you end up with a higher conversion rate, whether you're referring in or referring out. Traditional compensation models for specialty vary. What I've noticed for implant specialties such as perio, OS, and even some limited prosts that I like to call surgical prosts, I calculated there's maybe about 450 of these guys in the country. Fun fact. These guys typically come in and they work off of a percentage of the adjusted production. And I want to be able to define this for you guys very clearly, because oftentimes I get a call from an office saying, "I'm only going to pay on collections." And the record stops. And I say, "Well, doc, I got to be honest with you. Specialists frown on getting multiple checks from one production day." And then I get the classic, "Well, I mean, what about the insurance checks? I need some time until it comes in. I have to balance my cash flow." We tell them, "Doc, it's no problem. Think about it. You have your contracted insurance rates. What you bill out for that, as long as you're billing correctly, you're going to get a 99% or higher reimbursement rate based on that. Your PMS, practice management system, should be able to print out your adjusted production day sheet, which is a reflection of all the insurance money that you billed out for based on contracted rates and all the cash that you took in of co-payments or discounts from the UCR. In advance of starting with the specialist, you're going to want to understand to what degree you're able to discount from their UCR for out-of-network or cash patients. Some offices just take the strategy of just going out-of-network or just pure cash, because this way they're not bound by any in-network contracts. Of course, if you go that route, you lose the visibility from the directory of the panel from the insurance company listing your office as having an oral surgeon, let's say, available. For ortho and pedo, the compensations are a little bit different when it comes to in-house. Those are a little bit on the lower percentage side, but it usually involves a base of some sort. And there's almost always a per diem guarantee involved. And by no means is the specialist looking to get that as a production goal, which is something that you need to review with the specialist in the meet and greet when you have with them. But it's more as a way of just making sure that you're blocking off the day for them and you're respecting their schedule. And make sure you don't have any gaps in the schedule either. So let's go over a checklist of what you want to go over when you actually meet with the specialist, right? You say to yourself, "That guy seemed pretty good. What's next?" So definitely go online and just research the reputation, see what the patients are saying about them. You might be able to find them at their private practices or on other review sites from other offices that they travel to. Here's a tip that I'll give you that might be a huge takeaway, which is gauging their ego by what sort of equipment and supplies they're going to be asking for. There's really two kinds of specialists in that realm. There's the quote unquote prima donna that's going to come in and say, I want the most expensive X, Y, and Z because that's just the way I do it. And then you have, which is, thank goodness, the majority of the specialists out there, they're a little bit more easygoing and flexible when it comes to just making sure you have the adequate basics around. If you're going to change brands on them that are technique sensitive, definitely make sure you ask them about that. But things like disposables, like ambu bags and saline bags and things like that for the oral surgeon, you could go about purchasing the generic version. The formula integration based on the supplies that you're ordering. Talk to your DA, make sure that they're also on the same page as far as what oral surgery supplies they have to order. The implant specialists typically bring their own implant cassettes and their own implant kits as well, like the actual fixtures. And I would also talk to your colleague and see if they have any opinion about the specialists as well too. Usually these specialists are known within a cluster of a community. After you decide that you want to move forward with the specialist, I would definitely get together with the staff and have a meet and greet. Make sure that your office manager is present. And if you're implementing perio, definitely make sure that you get together your periodontist with your hygienist, because it's very important that they get a perio narrative protocol on the same page in full alignment. Obviously, you want to make sure that whatever the patient is told by the hygienist before being referred over for perio consult is in full alignment with what the perio says. Those perio evals tend to take about 45 minutes to an hour, and a lot is discussed there. Turnover of specialists, it's really bad. You got to avoid it at all costs. But the problem is this, I'll call it a challenge. It's inevitable. They're 1099 contractors. They're eventually going to be gone. They don't own any part of the practice. From what I've experienced, the average life cycle of an in-house specialist coming to a practice is anywhere between 3 to 4 years. Some offices get lucky and they find a specialist that just sticks it out for a very long time until they retire because they may have sold their practice or what have you. But the challenge is when you actually have a turnover of specialists is, number one, you have to go through the re-credentialing process again. Number two, the patients don't like it. They're like wondering what happened, right? Especially with specialties that have a continuity of care with like ortho for example. Be very careful with how you go about any transition with ortho, because that could lead to a high amount of liability for you because of the extenuated continuity of care involved with the patient cases. The recurring specialists like ortho, for example, is what I'm speaking about. Earlier on, I noticed a trend with the DSOs. They had a very high turnover rate. They were burning out the specialists, to be frank. There was sort of like a less is more offer for the private offices to go to for them, because they were able to work with more PPO, fee-for-service, payer mix offices and get to the same production level with 6 cases versus 15 cases. I noticed that most of the new grads were willing to take the DSO arrangements because they were hungry, they were motivated, but the burnout rate started to really hit hard after like year 2, year 3, where they started to think about domestic lifestyle and all that. And really, there's 3 types of specialists out there. There's a new grad, current practice owner who's like in his 40s, that's not full-time busy, but can use an extra day traveling outside of his referral radius or 2. And the specialists selling off their practices or have sold their practices, who just want to keep their fingertips wet. Most GPs have a difficult time properly sourcing specialists. Aside from the agency that I co-founded, Pair Dental, there are many ways that you can find specialists, but Pair Dental doesn't charge any upfront costs. It now goes through Cloud Dentistry, its parent company, and there's a good pool of a few thousand specialists you'd be able to reach. The difficulties that most offices are finding when they're sourcing specialists is, number one, there's a lack of equipment involved. Specialist says, I don't have anything. And what that ends up meaning is that the office is staring at a $25,000 ticket to buy a surgical drill, a nitrous tank, and the list goes on and on and on. Most surgeons are equipped though, but equipment does come in the way sometimes is one of the reasons that GPs are not able to find the right fit. Second is experience. Some GPs have had bad experiences with a specialist having a difficult case. And so they think to themselves, well, gosh, I don't want that in my own practice. And by the way, may I add that this is not a legal advice by no means, but I noticed that a lot of DSOs, they have independent contractor forms that the patients sign when specialists are treating them. This way, the patient acknowledges that they're being treated by an independent contractor that carries their own insurance as well, too. Case presentation ability, their chairside manner. Honestly, like, how good are they at being able to present a treatment when the patient has questions to ask? Different specialties have a different degree of necessity around that. Like, for example, with perio, most of the cases are asymptomatic. And with OS, it's more predictable. Patients coming in NPO in the morning, fasting, they're probably going to move forward with treatment. And their personality, that's also very important. I'm a big believer that the personality you're working with, you got to make sure that you guys get along really well. A specialist is different than the types of personalities from other professional types that you bring in. They were trained with a different sort of mentality post GP program. And many of them come in thinking that they're working for a restorative dentist. And there's sort of that dichotomy there. Of course, this has no reflection on their personality, but it's important to understand that there's that dynamic involved between the GP and the specialist and both personalities. And then there's clinical philosophies. And this is something you should definitely go over in the meet and greet, because different specialists prefer different types of techniques, post-op care, and so on and so forth. And of course, I put a bomb next to this one, egos. I won't get too much into that, but just be careful with that one. You'll notice it from the onset. Don't feel as if that you have to move forward with a particular specialist if you feel uncomfortable with their personality. Reasons why a specialist would disconnect. 75% of the time is because the office has lack of cases. But that means a million things, right? One office can mean lack of cases because they produce 3,000 per day. Another office means lack of cases because they produce double that amount. Other reasons may include because the office canceled or because there was a lack of communication. Like, why are you telling me about this the day before? Or lack of supplies and equipment. I told you, I gave you my supply list. Why didn't you order it? And transition situations, which is totally out of the control of the practice. Like, for example, the specialist wants to move to another state because of domestic reasons. But 75%, the majority of the time, is because of lack of cases. So what do? How do you control it? Most practice owners are scared to add the specialist because they think, oh my God, I'm going to go through all this work and I'm going to credential them. And what if I disappoint them? I don't want to fail with this guy. I got a lot riding on it. So you got to balance it out. There's a frequency that you can control. Think to yourself, how many cases am I doing myself that I can feed the specialist? Can I communicate with them more in advance? Can I be able to schedule the days in advance so far out that I can sort of predict all the days filling up if I was to imagine all of them on a graph all together at the same time? There's ways you can throttle it. You have to be very top of mind when it comes to specialists, because every day that you're referring to cases is the day that you're thinking about it. The factors that lead to the ROI of the daily specialty program include factors such as the types of insurances accepted. Not every practice is the same. You have your independent fee-for-service practices, PPO practices. I've seen tons of Delta fee-for-service setups, and where they're in network with Delta, out of network with everything else. The specialists' UCRs typically range to be the same, but they do differ. And the quantity of patients that you're lining up also play a major factor. And the types of cases that are being referred. You could refer in a full arch case once a month, and you'll probably end up producing more than 2 endo days combined. Again, at all costs, you guys got to make sure you avoid cancellation. It has a negative effect on the psychology and the production of what's going on. Possible pitfalls to look out for: post-op care. I would talk to your surgeon about asking if it's okay for your office manager to make the post-op care calls, as we call it, because when the surgeon is driving home, remember, they don't have their own practice. So they can't exactly be sitting in front of their notes in case the patient has any issues that they want to discuss. Specialist is always available. It's their liability much as before it is anybody else's. So they will travel to the patient if need be for any major post-op emergencies that may come about. And you want to make sure you're not missing any supplies. They get nitpicky about that. So get this procurement formula that I call your supply list down cold. Benefits of in-house specialty. Patients' anxiety is eased. You increase the integrity of the practice too. Put the specialist's name on the front door. Add his credentials, her credentials in there. It'll elevate your practice in the patient's eyes. You can also consider that the case acceptance rate is certainly going to go up compared to referring out. And it's a lot more convenient for the patient. Let's face it. You know, they don't want to go to an unfamiliar place. Chances are it's even further away. So in summary, you have more control over communication with insurances, increased revenue equity of the practice, more integrity of the practice, higher case acceptance, and your patients will feel more comfortable because they're familiar, and the insurances will pay you more as well. And let's not forget, the patient's trust is number one. Patient is number one in all of this. And from what I've seen out there, from the studies that I read, it's the hygienist that has the patient's ear. And nowadays, it's very difficult. This is the report from the ADA Health Policy Institute that recently came about. This was actually back in December. So it looks like that a third of the country is looking for a hygienist, more than a third is looking for a DA, 14% is looking for a dentist associate, and 20% is looking for an office manager. How difficult is it? Well, 81% said it's extremely challenging on a scale of 1 through 6, 6 being extremely challenging. And for dental assistants, it wasn't that far better. So this is what's been going on in the state of union, so to speak. One of the companies that I joined 4 years ago, called Cloud Dentistry, merged with Pair Dental. This is a unique way that is totally modernizing how dentistry is going about hiring. What's different about this that nobody else has is that Cloud Dentistry does not charge any middleman markups like staffing agencies do. Whatever you negotiate with the staffer or the talent that you hire, they keep 100% in their own wallet. The other piece to this is that Cloud Dentistry does not charge any buyouts. We don't have any middleman contracts to police in between. You pay them a small subscription fee of around $100 a month on average, and you get unlimited access to messaging and booking specialists. Messaging and booking dental assistants, hygienists, DAs, and GPs. We're just in the midst of merging everything from Pair Dental into Cloud Dentistry. However, I have relationships with all the specialists. My contact information is in the chat. I would encourage anybody to please reach out to me. I love being a resource for the dental community. If we have time, Kayvan, I would love to do a quick demo.
Yes, let's do it. Let's see a demo.
All right, perfect. Let me just pull up my login here and reshare my screen. I'll make this real quick. So, and I'll give you guys some tips on how you can go about hiring and retaining all the hygienists and DAs that your heart desires. So this app was started 8 years ago by a Harvard macroeconomics undergrad professor who is a very good friend of mine. He's the CEO of the company. His name is Trey Tipichin. Trey started this because he was having a chest bumping match with a dentist friend of his that he went to high school with over whose life is more miserable, being a dentist or being a lawyer. True story. I met these guys 2 weeks after they had the idea, and I joined them as an angel investor. 4 years ago, I joined them full time, and I saw the future of merging Pair Dental with Cloud Dentistry together. There's over 100,000 professional job seekers on this platform in 35 different cities, and there's close to about 5,100 offices with active paid subscriptions on this. So this is a dashboard of your office login. You would click here to go find professionals, and you toggle between your locations that you'd like to search for. And so I'm going to go search in Austin, for example, one of the cities that Cloud Dentistry is very strong in. And you can distill down with the type of professional you want to find. So for example, I want to go find a hygienist, and you could search by a particular date needed if you wanted to. This is available for both permanent or temporary hiring. It processes about 15,000 bookings a month, and half of them are for temporary and half of them are for permanent. You see everything you'd want to see about the professional that you normally wouldn't see on places like Indeed or through staffing agencies and recruiters. You get to see to the minute or to the hour when they last logged in. With Indeed and other job boards, you don't see that information because that's why you end up with a lot of stale resumes. You're not even sure when the person showed up last. And with Indeed, they charge you more with the more messages you send out. And everything I'm showing you now is available for free for the offices. We have a freemium to paid model. The paywall comes up when you want to message or book the professional to come in. And you can see the reviews that they left and the reviews the offices left for them as well. And I always like to say, I'd love being a resource. Please reach out to me. I would love to be You're partnering, finding talent between specialists, DAs, hygienists, and what have you. And one last tip I just want to throw out there. Nowadays, the reports show that under the age of 45, the super majority of all the hygienists out there, NDAs, they want to go part-time, they want to temp. So let's revolutionize the word temp a bit here, right? What you can do on the Cloud Dentistry app is meet a bunch of hygienists, decide who you want to work with, have them favorite you and you favorite them. And then when you send out the booking request, it's instantaneous. You can build a bench of hygienists behind you that will be available ad hoc to be booked on a long-term basis. And this way you're accommodating their lifestyle. At the same time, you're able to avoid any potential loss of production from sickness or, God forbid, or even vacations as well.
This is
Thank
so
you so much.
great. You know, I think it provides so many things that's needed in dentistry. One is transparency so that people can see, hey, what's the track record of this hygienist, right? Do other people like them? And then alignment. It really is aligning what the temps want and what the practices want and need. So fantastic. Right now, we're going to get into some Q&A. So thank you, Darius, again, for that presentation. It was wonderful. If you have a question for Darius or myself today, go ahead and put it in the chat right now. I think some of the messaging you're doing, Darius, I think was going to me, so I just put it into the panel for everyone to see. So again, does anyone have any questions for Darius or myself before we bring the webinar to a close? This could be about staffing. This could be about how much does it cost? You know, I'm looking for temp, permanent, anything like that you've heard. Would anyone like to ask any questions? Go ahead and put it in the chat. We did have some questions that came up before, so let me go to those. We had a question that came up. How much does Cloud Dentistry cost? What are the subscriptions, I guess, I think is what they're asking.
Depends on the market. And let's say there's 3 packages. You can get annual, semi-annual, or monthly. The monthlies are around 200 plus a month. The semi-annuals around 100 and change a month, and the annuals are all under $100 a month. There's some areas around the country that we're not there yet in terms of cities. Those locations, we're offering it for $10 per month, locked in for life, for the first 30 offices that sign up as a token of our appreciation for their support early on.
That's amazing. I love that offer. And another question had come in. Is this for temping or permanent placements?
It's for both. This is just an extra way to get the workforce connected with offices in a meaningful, transparent, and quick manner at a fraction of the cost of what dentistry is typically used to paying.
It's so interesting. So there's no sort of like, okay, we're hiring this person permanently. Okay, well, you have to give us a cut of what their salary is or anything like that?
None of that. And
Wow, yeah, that
I'll
is
be honest,
revolutionary.
it's, the thing is, I haven't seen it done yet.
I haven't seen it either.
Our competition just is either doing one or the other. They either force the classification of the professional by saying you have to be a W-2 or you have to be a 1099, not letting the office decide or the professional decide. Or they charge a middleman fee to pamper the rates, or they charge a buyout to police.
Absolutely, very valuable. So do we have any other questions that anyone would like to ask by either raising their hand or putting it in the chat for Darius or myself? So anyone have any questions that you'd like to ask? I think we had one other one that came in. How much does marketing cost a month? Okay, this is a question that had come in. So it really depends on who you're working with. You know, just like anything, you have the affordable, you have the expensive, and you have the people in between. For us here at DocSites, we're leaning more on the affordable side. So our websites typically cost between $1,000 to $3,000. That's a one-time fee you pay. The monthly fee is $59 a month. And then the marketing ranges from about $300 to $700 a month. So that's what it's ranging, no contracts. Of course, our website has more information. So if anyone needs anything, go ahead and do that. And again, I just want to remind everyone, for your CE credit, as a thank you for being here, you will receive that. Just be on the lookout in the email, because you're going to get something from myself. If you don't seem to get it, like I said, I put my email address, Kayvan@DocSites, into the chat. So feel free to hold on to that. If you have any questions, you can, reach out to us. And again, we're about to wrap up. So does anyone else have any final questions they want to ask for Darius? Just go ahead and put it into the chat. We had someone ask, what's your contact information? I believe we put everyone's contact information, myself and Darius. See if any other last final questions come up before we call it a close. No, I think that's about it. Again, I wanted to thank everyone for being here. I'm Kayvan Mott, co-founder of the DocSites. If we can help you with your external team and help you grow and get to where you're going, right? We're happy to help. You can reach out to us. We do have that special offer if you're interested. Text me at 818-489-9823. Or if you just want to see an assessment of, hey, how are we doing and where can we improve? I want to thank Darius with Cloud Dentistry, the premier platform for finding talent, temp or permanent. I love the presentation and the solution you guys have, and we're really grateful for everyone being here. So be on the lookout for that last email. Any final words you want to share, Darius, before we head on out?
Honestly, I just want to thank you. The service that you provide on a consistent, ongoing basis, educating the dental community, is so valuable. God bless you.
Thank you. Bless you as well. And we appreciate you guys. The dental industry is an amazing industry. I say this all the time. I'm like, people will leave companies. People will change companies, but they'll stay in the dental industry. Like, we really have, like, I think one of the best industries, because people stay there, and that's how they can like develop relationships and care. So we're really lucky to be a part of it. So thank you, Darius. Thank you, everyone. Be sure to be on the lookout for that email, and have a great night. Thank you, everyone.